Hello, I'm Marc and I'm the Head of Bereavement Care and Hospital Liaison at the charity SANS. And it's a great delight to be able to talk to you today about the bereavement care pathway, the National Bereavement Care Pathway for pregnancy and baby loss. And it's great too to be able to talk to colleagues from the southwest of England, where the vast majority of sites have already signed up to the NBCP, and also to colleagues in Wales, where there's so much interest, and we're hoping for good news over the next few months to the development of a national bereavement care pathway in Wales. So today I want to talk to you a little bit about the voice of bereaved parents and what they tell us about the importance of bereavement care. The recent audit that SANS carried out earlier in 2022, why we need care standards, how we've been developing the NBCP in the UK, and then finally a few next steps and how you can help to continue the development of the pathway. So although the trend is positive, there's still much to do to achieve the national target of the reduction of 50% of stillbirths and neonatal deaths by 2025. This equates currently to around 13 babies each day who are stillborn or die neonatally, or 4,000 a year. But we also know that with 1 in 4 pregnancies ending in miscarriage, there or thereabouts, the numbers of those who are bereaved every year is vast in the UK, and compared to other developed nations, our figures are poor. So whilst good quality care cannot replace a much longed for baby, of course, it can help to make the bereavement journey a little bit more manageable. And certainly poor quality bereavement care exacerbates the pain of loss. SANS has carried out a number of surveys of care over the last few years, many of which you'll be familiar with. And of a survey of care that we carried out in 2019 amongst 1,640 people, a third of parents said that they felt unable to raise concerns or felt that their concerns were not being taken seriously. 43% said they were not confident to do so. 20% were worried about annoying staff and taking up their time, and similarly the same number felt that staff were too busy. But more recently, a survey by our colleagues in the Twins Trust showed that 45% of women felt their care after their baby died was good, and 44% thought that it was poor or could have been improved. So there's an inconsistency in care, and some of these quotes help to demonstrate that. Bereavement care is obviously in the news, and it has been throughout 2022, as it has been for many, many years. The death of Cristiano Ronaldo and Georgina Rodriguez's baby son highlighted the importance of good quality bereavement care, and they thanked the doctors and nurses for their expert care in their statement. And similarly, a few weeks later on, of course, the Ockenden review into maternity services at Shrewsbury and Telford Hospital's NHS Trust was published. And in Essential Action 13, Donna Ockenden says that compassionate, individualised and high quality bereavement care must be delivered for all families who've experienced a loss, with reference to guidance such as the National Bereavement Care Pathway. And certainly since that report was published, we've been inundated with requests for information regarding the NBCP and bereavement care more generally. So with this background, I'm going to talk to you about the bereavement care pathway. There's an inequity and an inequality in bereavement care across all 5 experiences of baby loss: miscarriage, including ectopic and molar pregnancy, the termination of pregnancy due to fetal anomaly, stillbirth, neonatal death, and the sudden unexpected death in infancy. And that inequity back in 2016 led to the all-party parliamentary group on baby loss to commission SANS with its partners to develop a national bereavement care pathway to improve standards and to realise the vision that all bereaved parents should be offered equal, high quality, individualised, safe and sensitive care. Our more recent audit, and thank you to those of you who completed this through March and April of this year, but also highlighted that although things have improved since the introduction of the NBCP in 2017, there's still much to be done. I've mentioned the Ockenden review and why staff should be sharing compassionate, individualised and high quality bereavement care with bereaved parents. And the audit showed that not everybody is able to do that. 49% of trusts and boards make bereavement care training available to staff across the range of healthcare professionals, and clearly it should be more than that. But only 12% are given time in working hours to attend this training. I've run many workshops where staff have said, I'm here on a day's annual leave and I've had to pay my own train fare to get here. This should not be so. Around 3/4 of trusts and boards tell us that bereavement care training is available to midwives, and that was the highest percentage amongst different professional groups. But only 47% reported that it was mandatory, and only a third said that time is given in working hours to attend it. So therefore, it's vital that staff are trained, 100% of staff are trained in bereavement care after the death of a baby, so that they're able to say the right things, to take the family through the early part of that bereavement care journey, and to deliver the 9 standards that I'll talk to you about in a moment or two. Our audit also captured views around staffing, and it said that 12% of trusts and boards have no bereavement specialist working in their maternity service. The average number of full-time equivalent staff working in a bereavement specialist role across maternity units, fetal meds and neonatal care is just over 1. And that breaks down to just over 0.5 bereavement specialists for each fetal medicine or neonatal unit, and just under 1 for each maternity unit. And when you cross-tabulate that against data from Embrace, we estimate that that means that on average, each bereavement specialist has just 2 hours of working time to dedicate to each death, including all aspects of the role, such as supporting the families directly. And again, this needs to change. More staff need to be trained, and we need to have more specialists able to provide the bereavement care that's necessary. And in terms of bereavement rooms, we've seen the number of bereavement rooms and suites grow substantially over the last few years. So it's great that 97% of trusts have at least one suitable or sensitive room where bereaved parents can be cared for. But only 29% of rooms are within earshot of other babies. More than half can only be accessed by walking through the maternity ward, and around 17% haven't included bereaved parents in the consultation around the design. So whilst we can see that most hospital trusts and boards do have a room where a mother can be cared for with her partner, it's not always the case that that's an appropriate room, because they are often within earshot of other healthy, crying babies and joyful families walking through a maternity ward. The bereavement care pathway, as I said, sets out 9 bereavement care standards to help improve bereavement care amongst staff for parents and professionals. Firstly, informed choices. Parents must be given informed choices about their aspects of care and the opportunity to make decisions. That validates their parenthood and makes them feel that they've got some element of control during a phase that is largely uncontrollable. Secondly, they should have the opportunity to make memories. And many of you will be familiar with the availability of photographers to take sensitive photos after a baby's died with their family. The provision of memory boxes from SANS and other charities to enable hand and footprints to be made, for memory books to be written in, for birth certificates to be taken home, and maybe indeed the opportunity to take baby home. But above all, parents want time with their baby, to hold them and to create those precious memories with their babies and with their families. Linked to that, the bereavement rooms, as we said, these need to be accessible, where parents can receive the support and the care that they need from professionals, but actually away from busy labour wards and other units for other types of loss. A bereavement lead, someone who takes responsibility for the provision of bereavement care, and as I said earlier, the importance of bereavement care training. There's an e-learning for healthcare module that many of you will have completed. Just search bereavement care pathway within it, and you'll find 2 modules. One's very short, 10 minutes. Another one is a 30-minute, more focused for those healthcare professionals who are working most closely with bereaved families. Many of you have completed this during COVID particularly, but please do access it and share that with your colleagues. And there's lots of online and face-to-face training that's available, the vast majority of it being free from the SANS website. So do take a look there as well. Sixthly, there should be support and resources for healthcare staff. They should be supported in their role. We thank you and we acknowledge you for the emotional investment that you put in to newly bereaved families. It takes a lot to do the role that you do. And it's therefore important that you have the right support in terms of the staff that are around you, but also that you know you can go to SANS and you can call our helpline if you've had a particularly difficult shift. And also that you've got the right resources available to you. A cold cot, for example, the memory boxes and bereavement care pathways and materials. And the final three standards, that there should be a bereavement care plan that is led by the parent in conjunction with the lead professional, a system to signal there's been a bereavement so that colleagues are updated quickly after the death of a baby. Does the local GP surgery know, for example, has that information been transferred to the health visiting team? And finally, that the woman and her partner indeed should be assessed for and where appropriate referred to support services with regard to their emotional and mental health. So just by way of an update, around the UK, there are 100 or more, probably 101 at the moment, trusts who have voluntarily signed up to the National Bereavement Care Pathway. And if yours is one of the last 20 or so that hasn't done that, please do so. Please go to the website, nbcpathway.org.uk, and take a look at that and encourage those around you to sign up so that we can get you on board the NBCP. It is free to join. We've been moving from this project phase over the last few years to now embedding that within practice. And we're about to create a huge suite of resources over the next 12 to 18 months to enable implementation of the NBCP. I'm delighted that all bar one South West NHS trusts have signed up. In Wales, lots of boards are already using the resources that are available on the website, and we're working with the National Bereavement Subgroup to develop bereavement standards. And we're obviously really hoping that soon there will be a national bereavement care pathway around the death of a baby and a pregnancy loss in Wales. So again, do promote that locally amongst your boards and get in touch if you'd like to work with us on that. And just to say too, that in Scotland, we've got 4 early adopter sites working on an NBCP in Scotland with the support of the Scottish Government, and we'll be launching a second wave later this year. In Northern Ireland, again, lots of boards do use the National Bereavement Care Pathway resources, and we've made a bit of progress, but obviously there's still much more to do, and we haven't been able to push that as far forward as we would like due to the current political situation now. So in terms of our next steps, we will continue to promote high quality bereavement care standards, and we'd like your feedback on those. So please do have the conversation and let's get in touch and hear more from you about what this looks like on the ground and what we can do to support you to provide the best bereavement care possible. We'd encourage those last trusts in England to sign up. We want to learn from the early pathways in Scotland and to push for formalisation of pathways in Wales and Northern Ireland, as I said, as well as working with statutory organisations to embed standards in national frameworks, guidelines, competencies, education, curricula, and so on. So again, please work with us on that. And let's together never stop advocating for bereaved families. They need our support and the best possible bereavement care that they can receive. And the NBCP is there to help you to do that, as is SANS and our partners. So please do get in touch. My email is there, mark.harder@sans.org.uk, Marc with the C, and also our website, www.nbcpathway.org.uk. Thank you so much for listening. 15 minutes has gone by very, very quickly indeed, and I hope we have the opportunity to discuss the 9 standards and the implementation and the importance of bereavement care standards after the death of a baby in more detail after this session. And there's a number of ways that you can get in touch with me and my colleagues at SANS, both through email and through Twitter and via our website. Thank you very much for listening, and please stay in touch.